Hello, I'm Dr. Mark Newman. I'd like to welcome you back today. Remember, we believe that when you change your health, you'll change your life. And our goal for you is to add years to your life and life to your years. I want to invite you back tomorrow when we continue talking about hypothyroidism. We're going to continue the discussion of hypothyroidism, specifically the cause of hypothyroidism. The primary cause of hypothyroidism is Hashimoto's thyroiditis. This is an autoimmune disorder that causes inflammation of that thyroid gland. Remember, we told you it's a small butterfly-shaped gland in your neck. When you have Hashimoto's thyroiditis, there's inflammation of that gland. It's actually an immune reaction where the body is working against itself. It causes decreased function in the thyroid gland, and with that comes a decrease in hormone production. Remember, we said the thyroid gland is the master gland of all things metabolic in the body. So when you have dysfunction like this, your body is not going to work well, and there can be many symptoms, and we will get to that in time, talking about the symptoms to expect when you have thyroid dysfunction. The exact cause is actually unknown. We do know there are some certain factors that cause Hashimoto's. Number one, there is a genetic tie-in. So if you have relatives, especially a mom, a sister, an aunt that has Hashimoto's, has thyroid problems, it is possible that you might be a more likely candidate. We also know that hormones play a role in this. In fact, females are usually affected about 7 times more often than males. So we know that there's a hormone tie-in there. Number 3, we also know that if you're a susceptible individual for this disease process, that high amounts of iodine can play a role in this. So avoidance as far as iodine is concerned, as far as high amounts, could be a benefit to that person that knows they might have a genetic predisposition. We also know that radiation exposure can trigger Hashimoto's, and that can be anything from employment, environmental, or medical exposure. Now, most commonly, this condition tends to be found kind of in middle age. So 40 to 60 age group is where we most commonly see this show up. And it can be a progressive disease too, where you might have initially just small amounts of symptoms and then it progresses in time. Again, we said it's more common in females. It's also more common if you have other autoimmune problems. So, if you're a type 1 diabetic, if you have celiac disease, rheumatoid arthritis, lupus, Sjogren's, celiac disease, these will more likely predispose you to having Hashimoto's thyroiditis. Take a look at the blog post on our website where we go into much more detail about hypothyroidism and Hashimoto's thyroiditis. Also, remember to like us on Facebook, subscribe to our YouTube channel, and leave us any questions or comments that you have about your own personal struggles with hypothyroidism. I want to invite you back tomorrow when we continue talking about hypothyroidism. This is Dr. Newman. Thanks again for watching.